Hello, good morning, good afternoon, good evening, wherever you are joining us across the world or listening to us post podcast. This is the AfriDES podcast, the African Digital Economics podcast, that seeks to explore the happenings around the digital economy on the continent of Africa. My name is Kelvin Giraji. Today we'll be looking at the role of the legislature in specialty healthcare provision and education in shaping Africa's digital economy. And then we have, as panelists today, the House Committee on Specialty Healthcare, led by the committee chair, Dr. Alex Egbona, alongside the clerk of the committee, Mr. Tordue Nyitse. Thank you for joining us, Dr. Alex and Tordue Nyitse. We would like to begin with the chairman. Mr. Chairman, sir, what is specialty healthcare and why is it crucial for Africa's digital economy?
I represent that because federal controversy, the House of Reps, and by the grace of God and the leave of the Speaker, I'm the chairman of this specialty healthcare committee. It's a new committee splitted out of other committee in the Ninth Assembly. I have only two committees, but now we have about 7 committees. The intent is to make healthcare to be delivered to even the grassroots. That was the essence of this specialty healthcare. And the name implies it involves all the specialty institutions in Nigeria and beyond. We have hospital like neuropsychiatric hospital, orthopedic hospital, fistula hospital, etc. And the eye care centers, nose and ear centers across the country. That is the area we covered. Legislation is crucial in setting the standards for healthcare delivery and sustainability in Nigeria, because there's a lot of, in Nigeria, the awareness of healthcare is not actually, is very, very inadequate. And if pointed to, we have gone around almost the 6 geopolitical zone. We discovered that healthcare cannot be given the adequate attention.
Okay, thank you, Mr. Chair. Over to you, Mr. Clark. I know you've been around the National Assembly for over 12 years, and then you've happened to find yourself in this very strategic committee that aligns very, very well with the digital economy, which this podcast seeks to advance. So I would like to ask, what are the key legislative challenges in providing specialty healthcare in Nigeria and vis-a-vis Africa?
Okay, thank you, Kevin, for giving us the platform. My name is Tordue Nyitse. I'm the clerk to Committee on Specialty Healthcare, the House of Representatives. As the chairman said, the mandate of the committee covers the specialized areas of health provision in Nigeria. And the wisdom of the leadership of the House, of the 10 House of Representatives, they created this committee because of the health sector is wide, and the need, the commitment of government to provide specialized health care to Nigerians is the essence of this committee, to give proper and adequate oversight to those sectors as mentioned by the chairman, covering psychiatric, mental health. Across Africa, in Nigeria, mental health is becoming an epidemic. And with the application of technology and digital knowledge, you agree with me that that's the only solution to providing accessible, adequate health coverage for people who have mental issues. And the other aspect of the specialist care provision covers oral health, even traditional and alternative medicine, and orthopedic and trauma, and DVF fistula centers. We have about 4 fistula centers in Nigeria. All these are specialized units that need professionals qualified, and with the Japa syndrome happening in Nigeria and across Africa, you agree with me that Nigeria has to be deliberate about regulation of these key sectors in order to retain professionals within the country. And we can apply that across Africa to see how we continue to produce professionals. And that calls for the education aspect of that education provision. So in terms of legislation, we need, even in the establishment of those specialized institutions, legislations are needed. So the committee has the mandate to ensure that each of the agencies being established by maybe administrative, by the executive, are backed up by legislation. So it's the work of the committee to ensure that we provide adequate legislations around those key specialized areas. Thank you.
Yeah, thank you, Mr. Clark. Let me come back to you, Dr. Alex. How can legislation support the education and training of healthcare professionals, particularly those around leveraging technology or advanced technology in delivering healthcare across Nigeria?
I think the major issue, and as Ella mentioned, there will be a correlation between legislation and funding too. We need a lot of funding, especially in the area of scholarship, which will be sponsored to study special areas. That is what is lacking in most cases. And two, just as my class had mentioned, with the syndrome of Japa, which is prevailing in Nigeria now, so many Nigerians have left the country. So we need legislature to make sure that doctors are well paid. There's adequate funding in the health sector. What the health sector lacking now is adequate funding. And by the time we provide enough money, I think the sector will come to reality. Thank you.
Yeah, thank you, Mr. Chair. If you are just joining us, this is the AfriDES podcast. We are speaking to Dr. Alex Egbona, the committee chair for specialty healthcare, Federal House of Representatives, Federal Republic of Nigeria, and Mr. Tordue Nyitse, who happens to be clerk to the committee. Mr. Tordue, I would like to nudge it over to you. How can public-private partnership be leveraged to enhancing specialty healthcare education and provision in Nigeria? Because what we see now is a lot of people are working in silos. How can we engender collaboration and public-private partnerships?
Yeah, I think especially in the health sector, and particularly in the specialized specialist hospitals, that partnership and collaboration is highly needed, and I think it's the right time for it. There are a lot of challenges facing these hospitals or healthcare provision institutions that earlier mentioned by the chairman, the issue of funding. Apart from funding, you have the challenge of power, electricity. You know, for most of the equipment, the medical equipment and the laboratories need to be 24 hours power supplied to, and you lack power, and then the training of professionals and effort to retain those professionals. These are the challenges that face these institutions, even across Africa. And I believe that government support or provision in terms of annual appropriations may not be adequate, actually not adequate. So the collaboration and support from INGOs, international development partners, and other organizations, or even private partnerships. So the issue of TTP is working with government to ensure that specialized healthcare provision is delivered to people is key, particularly in the area of power and energy provision. Uh, Most of the discussions that we're having on the committee with the heads of agencies is to rely on renewable energy provision. Regular electricity sources that we have. So in doing that, we have ongoing discussions with heads of agencies, including even the ministry, to seek partnership with the private sector in building alternative energy supplies. This is so for us. I think the picture for sustainability of health provision, especially in the specialized health institution, is partnership with private sector and other development partners across the world that will sustain what we need. And legislation to me is key to this partnership, because even when you are having partnerships based on agreements and based on interests, and it's legislation that could clearly define how that those interests can be for the benefit of the people and ensure health provision and sustainability. Thank you very much.
Awesome, awesome. Yes, Mr. Chairman, currently the disparity we have in healthcare provision across the rural, the gap in terms of provision of healthcare in Nigeria, it's the gap is quite large from rural to urban, and that has led to both rural to urban migration, and of course that is more enhancing the Japa syndrome, because currently what we see is if you transfer medical doctors or specialty healthcare professionals to rural communities, they tend to not operate there for a very long time and they move away. The next follow-up question will be, how can legislative reforms address the disparity in healthcare access between the urban and rural centers?
Kevin, that's a very good question, and that boils down to what I'm doing already. I'm preparing a bill, which I think very soon we go for. As soon as we resume, we go for first reading. It's all boiled down on finances too. Because let me give you a typical example. I have a health center in my community that I have make sure that it's up to the standard of you can call it a full medical center, but there are no doctors there. What we have there is nurses. Why? Because in rural area, and one, the disparity of what is paid doctors in the township is not what they are paid them. In my state, people who, let me use the education sector as an example, rural teachers are paid higher than urban teachers. If you can replicate that in the health sector, it would be a wonderful idea too. That is one. Two, the issue of, for instance, there's called a TED fund, tertiary educational funds that are help schools, tertiary school like university and polytechnics. If we can replicate that in the health sector, I'm putting a bill on a health bank. The health bank will not only involve government, we buy with the private sector, the NGOs and other sector to help the health sector, because health cannot be only be funded by government. And so doing two, even in the 2024 budget, I have a provision. We made it my own in the health, especially healthcare budget. We made a provision for some health centers to especially this area of solar light. We want to establish on solar grid some about 6 or 7 health centers in my community, just to attract people, because a doctor cannot stay in a situation where there are no light. So it's more down on what the only way we can do is give them some necessary incentives. If you pay a doctor who's supposed to be in my community, the rural community, you give them incentive, he's paid some good money, he's given a fund accommodation, he's even provided with a car, there's a chance that he will stay. Thank you.
Okay, yeah, thank you, Honorable Alex. But before I take on Clark, Honorable Alex, can you highlight the community you are representing again, please?
Okay, I'm representing Abi Yako Federal Constituency. Abi Yako is in Cross River State.
Awesome,
And plenty of the communities are rural areas. So we are doing enough to make sure that we bring health facility into those rural areas.
Thank you, Mr. Chairman. Thank you. Over to you, Mr. Nyitse. What are the prospects of a unified regulatory framework? Because currently what we have is either the state government are having their regulatory framework, the national is having theirs, or nations having theirs. There's a lot of disparity in terms of both policy and regulatory framework. So what are the prospects of unified framework, and what impact do you think a unified regulatory healthcare framework will have on both the continent and Nigeria?
Yeah, Kevin, I am trying to agree with you on what would be kind of the unified regulatory framework, maybe for Africa or for global at a global level. But lawmaking, the law is for people, and it's peculiar communities, peculiar to nations, it's peculiar to states. So what happens? What we have is that there are frameworks, legal frameworks at the global stage, at the level of UN, World Health Organization. There are agreements, there are policies, there are legislations at that level, and those legislations, agreements are signed by nations. Even at the level of sub-regional levels, like in Africa, you have the African Union, and they have regulations, they have legislations at that level. You even have the African Parliament, you have the ECOWAS, then those come down to the level of nations. So in Nigeria, we also have legislations covering the health sector. The National Health Act was passed 2 years back, and if you look at the National Health Act, it gives a semblance of global legislations covering certain health issues. And if you look at the Health Act that's operative in Nigeria today, compared to what is obtainable in Kenya or South Africa, you see that there are similarities because of the issues in Africa. So there are issues in the National Health Act that are implementable in certain states. There are challenges in certain states. Like if you take the issue of IV fistula, we have fistula challenges in the north. So uh, uh, those states pay attention to priorities in those areas. So the harmonizing legislations for me is an ongoing process, and that it's happening at the global level, it's happening at the continental level, and even at sub-regional, continental, sub-regional levels, and at the national level. So Nigeria has taken both steps in the health sector in terms of laws and regulations. I mentioned the National Health Act. We have several other acts, like even in the specialized health sector that we're talking about. We have the National Mental Health Act that was passed in 2022. We have the law around alternative medicine. We have several laws that are passed within the specialized health sector, even the oral health, trying to establish an inter-country oral center in Jos, which has a mandate for the whole of Africa. So that's a clear case of a law that is catering for the whole continent. So for me, in terms of legislations, that cohesion is being built. and there's a clear understanding of legislative processes across Africa, despite the fact that some countries have different forms of legislative structure. Like in Nigeria, we have a bicameral legislature of two chambers. We have one chamber in certain countries, but we have platforms, legislative platforms across Africa at the level of the continent, at the sub-regional level, where legislators meet and could create ideas and share information and take back to their various nations. So I believe that harmonization is naturally taking place with peculiarities in nations and in communities. Thank you.
Okay, yeah, thank you, Mr. Clark. Mr. Chairman, before I ask you the next questions, which will be the future outlook of your committee, are you comfortable with the national budget provision for health?
The national.
Are you comfortable with the national budget provision for healthcare provision
No,
in Africa?
it's not all. Well, let me be favorable to Nigeria because I've not seen the budget of other countries. I think in
Yes.
Nigeria is very, very inadequate, as I've said already. Very, very inadequate. I think
So
I'm
like,
appealing to the
so
ministry and the state government too. We are appealing to the state government, the federal government and the ministry, the federal ministry of health, to do something about the budget, especially as related to the 2025 budget that is coming up very soon.
Awesome. So what future should the world be looking out for the committee on specialty health?
We are believing that it's a learning curve. We just, as I told you earlier, is a new committee, and we are working very hard. Me and my clerk, in collaboration with other members, we're about 30 members, to make sure that we leave a landmark at the end of this 4-year tenure. So maybe after maybe none of us will be in the committee again. So we are working very assiduously, very hard to make sure that, like, we are very concerned on the issue of mental health, because in our tour, we discovered that in our oversight, especially when we went to the orthopedic and the psychiatric hospital in Ikeja, we discovered that there are so many young men, big men, children, for in more cases, who are suffering from mental health. And how do we address that? When we went to Lagos, beyond outside the hospital, you see people lying on under the bridge because there are no accommodation in the hospital as well. So we are trying to draw government attention. Of course, there is a proposal coming on too to avoid stigmatization. There's a proposal coming on for Prime Minister Head on how they can change some of these health institution names just to call it specialty healthcare hospital rather than orthopedic, psychiatric, fistula, because of stigmatization. So we are working assiduously very hard. You can agree with me that before the end of the 4 years, there'll be a lot of changes, especially as it concerns the specialty health facilities. Thank you.
Yeah, also, Mr. Chairman, Mr. Tordue, what is your closing thought? We are gradually coming to the end of the podcast. What will be your closing thoughts on the topic today? And what will be your call for both collaboration and support for the Specialty Healthcare Committee of the Federal House of Representatives, Federal Republic of Nigeria? Thank you.
Thank you so much, and we must appreciate you for the platform to us. As we said from the beginning, the Specialty Healthcare Committee of the House of Representatives, as the name suggests, is a very special committee that has been created by the leadership of the House at this very special time. And there's also a call from the House of Representatives to the global community to support the legislative activities of the committee to ensure that adequate legislative support and framework provided to the over 20 agencies that are under the mandate of the committee. And as the chairman mentioned, the committee is working hard for developing a legislative activity framework, which for us is plan of activity for the committee that we showcase our initiatives and innovations that we want to bring on board to share with stakeholders. That's being worked. Once that is delivered, we're calling on the global community interested in the 5 thematic areas that we're working on: the mental health, orthopedic and trauma, uh, uh, fistula, oral health, alternative medicine, to key into what we are doing, because the essence is to give adequate support in terms of provision. By the way, you know that the powers of the creation or the powers of the force in the administration of government in Nigeria lies with the legislature, with National Assembly. So the provision of funding, adequate funding at that, lies with the committee for those specialized agents. So um, we have the rule to ensure that these agents are properly funded. Either the sources of those funding is coming from government or coming from PPPs, partnerships, or even from support from INGOs or development partners. So once we're done with the framework, we believe that with the need for proper engagement with international and global organizations. And we appreciate this platform talking about digital transformation in Africa. And we believe that if uh, issues of mental health and issues of sustainable alternative medicine provision and other special aspects of health provision are not addressed, Africa will be lagging behind in the achievement of digital economic transformations as we aspire in this program. So these are my final thoughts, and it's a global call that we have a committee, the model in the African legislature in Nigeria, the House of Representatives, that need to be supported to provide adequate legislative and legal framework for specialized health solutions. Nigeria setting a standard in Africa. Thank you very much.
Yeah, thank you for that global call. Once again, the clerk of the committee has called on global stakeholders around relevant in delivering specialty healthcare around the world to assist the committee in driving home their mandate and aspirations. But Mr. Nyitse, before you run, I want to take a follow-up question. Like, when you were inaugurated, what was interagency collaboration? How will you assess the intercollaborative agency intercollaboration as at when you were inaugurated? And what measures are you putting in place to encourage interagency collaboration, as particularly agencies under your committee?
Okay, so with the permission of the chairman, we have had very fruitful engagement with all the agencies and institutions under our committee. I think we have within the government institutions, we have up to 23 um, agencies, including the ministry itself, because the way the National Assembly oversight function is structured is that if you have committees that are overseeing one agency, one ministry, there are certain aspects of, so the ministry itself, there are departments within the agency that are responsive to us, that we have the oversight over. And then the psychiatric hospitals, we have orthopedic hospitals and psychiatric, I think about 7 orthopedic hospitals in Nigeria, and 10 psychiatric hospitals, and 4 fistula centers, and 2 dental institutions, and medical laboratory institutions. So total of over 20 something agencies. And we have engaged them severally. During the budget events, they came under the committee to make their proposals, and we worked with them to ensure that the 2024 budget was passed for them. And then the committee organized what we call the stakeholders station, interactive station with agencies and key stakeholders. So all the agencies were around, and other international organizations in Nigeria that are interested in this area, and NGOs were invited. So we're not just working with the agencies that are under our mandate in government, we're also working with identified NGOs, even local NGOs and international NGOs that are operating in Nigeria. So we have a very robust stakeholder forum that's being built. So when we inaugurated, we've had about 3-4 activities that involve these stakeholders that I mentioned. Thank you.
Okay, thank you. With that, we've come to the end of today's podcast, exploring and then being engaging, talking to the Committee on Specialty Healthcare, the committee chair, and of course the clerk. It's a pleasure having both of you. Thank you,
Thank you.
and enjoy the rest of your day.